Okay, so we're back with Chapter 21. We're going to start with the different types of acne. So acne occurs when the sebum channels are blocked. Often bacteria are involved in this process of the actual infection with the pimples and the development of the pus that's associated with it. Comedonal acne is just kind of regular, normal, kind of as it comes and goes throughout life. Just cleaning agents applied topically, so just basically washing your face. There's no effect on sebum production. It's just one of those things that I think basically we all go through at one point or another. Inflammatory acne is actually a much more severe case of acne. It's associated with a bacteria called Propionibacterium acne. The bacteria metabolizes the oils on the skin, causing an inflammatory reaction, hence the name inflammatory acne. And then special antibiotics are used for this type of infection, but the antibiotics are dangerous because they cause birth defects. Nodular acne is progressive inflammatory acne. So basically, if inflammatory acne is not dealt with, is not taken care of, it progresses to nodular acne. Painful pustules under the skin, permanent scarring. Medications, again, are available but cause birth defects. There definitely are hormonal actions involved with all types of acne as well. That's why people usually during puberty that's when you get the worst outbreaks of acne. And then, of course, when women are pregnant, hormones are going to fluctuate a lot. So, and plus the immune system kind of fluctuates too during pregnancy. So a lot of these things can compound these effects, where a pregnant woman could very well get a more severe form of acne, but can't take the medicines because the medicines are dangerous for the baby. So really kind of a snowball effect there with acne and pregnancy and all that. Viral diseases of the skin. We actually talked about quite a few of these already, so a lot of this is going to be a review. So papilloma. Papillomas are warts. So warts are caused by papilloma viruses. Warts are usually benign skin growths. There are several different types, but of course we now know that human papilloma virus, which causes genital warts, is linked to cervical cancer in women. So that is a discovery that's been made. So HPV is considered to be an oncogenic virus because it leads to cancer. We've talked a lot about smallpox. I don't remember if I actually gave you the name variola. That is the name of the smallpox virus, the variola virus. So you guys should definitely know that. Smallpox was very common throughout the Middle Ages. It absolutely devastated Native American populations during the Age of Exploration because there was no smallpox in the New World. So Native Americans had no natural defenses against it. Their immune systems had never ever seen anything like it before. So when Europeans came over and started interacting with Native Americans, smallpox is one of the major diseases that wiped out huge numbers of Native Americans from the New World. You guys already know that it was the first disease that a vaccine was developed for, and the first disease to be eradicated from the human population. We talked about Dr. Jenner and the link to cowpox and all that stuff, so that stuff, could possibly come back on the tests, but it'll be more like this information that's presented here. And we talked about how with smallpox, the only real danger now is bioterrorism if it's used as a biological weapon. So we know that chickenpox is a herpes virus. It's called the varicella virus, and it's basically herpes virus type 3 for humans. So you should definitely know that chickenpox is a type of herpes virus, and that it's the varicella virus, which we've talked about already. We've talked about, actually I don't think we did talk about Rye syndrome. That's probably my pathophysiology course. So this is a severe complication from chickenpox where death can occur. This is why you never ever give children, you don't really give anybody, but especially children, you never give them aspirin when they have chickenpox. There is a reaction that occurs when someone has chickenpox and is given aspirin. This can lead to Rye syndrome, which is very dangerous. Shingles is herpes zoster. That's when the chickenpox virus is basically hiding out in the nerve cells, and it becomes reactivated for whatever reason. We don't really know why. And then it reinfects the person. So shingles is much more severe and much more painful than chickenpox. And occasionally the person ends up with nerve damage as a result of the reinfection from the chickenpox virus. So certainly the chickenpox vaccine is available. It's being used a lot more. So the this information about the chickenpox vaccine, it has increased in safety and in effectiveness. And we certainly talked about chickenpox, and we talked about the chickenpox vaccine before as well. So herpes virus 1 or herpes simplex 1 is what results in cold sores or fever blisters on the lips, easily transmitted through contact with the lips, so kissing, obviously. Human herpes virus 2 or herpes simplex 2 is genital herpes, which is an STD. It does have different antigens from simplex 1. However, it does seem as though it is possible for these viruses to be cross transmitted. So what that means is someone with herpes simplex 1, if they're having an actual outbreak of fever blisters, and if they perform oral sex on someone, it is possible that it could cause genital herpes, and then the reverse is true as well. For years, doctors thought that wasn't possible, but now it does seem as though it's possible for these viruses to kind of cross. And then either virus actually can cause encephalitis. It's fairly rare, but it can happen. Of course, once you get either of these viruses, you have it forever, and you will get periodic outbreaks, usually during times of stress or during times of your immune system being compromised. That's why fever blisters get the name cold sores, because if you have the virus and then you get a cold or you get the flu or something, you can actually get outbreaks of the cold sores just because your immune system is kind of shifting its attention to that infection that you have and not so much at keeping the herpes virus in check. Measles is the rubeola virus. Extremely contagious virus that has been nearly eradicated from the United States due to vaccination. But we know that people are starting to not get their children vaccinated for measles, and it's starting to cause small little outbreaks throughout the country because of lack of vaccines. Measles is especially dangerous to newborns and babies, but the vaccine is not effective until after 1 year of age. This is the huge worry about the measles vaccine not being used, because if you have 5 and 6 year olds who are at daycares or at parks or out in public with young babies, and the 5 or 6 year olds are not vaccinated for measles, they can actually give measles to the baby. The baby can't get the vaccine because it's too young, and the baby can actually die of measles. And this can happen even if the young child is not having an outbreak. You don't know that the child is carrying measles, and the child can actually give it to babies, and that can lead to death. So very, very serious concern right now with some people who aren't getting their children the measles vaccine, and that's why some daycares and schools are actually refusing to have the children attend because of the lack of vaccine. So measles have a similar development as smallpox and chickenpox. Infection begins in the respiratory system, and the trademark symptoms occur 1 to 2 weeks afterwards. The trademark symptoms, of course, being the little red spots on the skin, fever, nausea, vomiting, and then, of course, the red spots are very itchy, and if you scratch them, it can result in scarring. Pneumonia and encephalitis can occur with measles. Again, somewhat rare, but especially in young children and the elderly who don't have very strong immune systems, the measles virus can lead to more serious issues and problems. So rubella is German measles, which is a very mild version of measles, but very dangerous to fetuses when their mothers get the disease. It's called congenital rubella syndrome. Fifth disease is a facial rash that develops from a human parvovirus, usually in young children, again, weakened immune systems that aren't developed yet. And then roseola is a common childhood disease with a high fever and a rash caused by a herpes virus. And again, same thing with as fifth disease. It's just usually it goes after children because they have a weakened immune system. Some fungal diseases of the skin. So we do have some issues with fungus due to their ability to kind of adapt to the skin conditions that would be inhospitable to bacteria. Fungus doesn't care so much. So dermatophytes is fungus that lives in the hair, nails, and superficial layers of the skin. And the infection that results from this is either called dermatomycosis or cutaneous mycosis. Derma means skin, cutaneous means skin, so just interchangeable here. But usually it's just called ringworm. So I'm sure you guys have heard the term ringworm before. Hopefully you know it is a fungus. It is not a worm. That is a total misnomer. Just, years and years and years ago, they thought it was a worm, but it's not. It's a fungus. And then there's all kinds of different versions of dermatomycosis. So again, dermatomycosis, same thing as ringworm. Tinea capitis is ringworm of the scalp. Tinea curis is ringworm of the groin. Sometimes that's called jock itch. And then tinea pedis is ringworm of the foot, and we call that athlete's foot. The reason we call it jock itch and athlete's foot is because oftentimes you get ringworm from sharing showers. So in a locker room, athletes that, they share, the shower facilities. Certainly ringworm is an issue with young college students living in dorms for the first time, as well as people in the military, because again, anytime that you're sharing living space, you're sharing a bathroom with lots and lots of people, you can certainly have an issue with this. The thing about ringworm, remember, it is a zoonotic disease, so humans can get ringworm from animals, and animals can get them from humans. Often does affect young children in kindergarten or daycare because their immune systems are developing and can't deal with it. So what can happen is if you have a young child in kindergarten, they can contract ringworm from a classmate. They can come home, they can give ringworm to the dog, to the cat, to the rest of the family members, and it just becomes a big old mess. The main thing with ringworm is just, you get that dry, irritated spot on your skin. It doesn't, look very nice, and it can take quite a long time to treat it with medications. It's nothing that's super dangerous. It just has to be treated with medicine, and you often end up having to treat all the people in the household as well as the pets. Another fungal disease is called sporotrichosis or subcutaneous mycosis. This is when the fungus enters through cuts in the skin from soil. So sporotrichosis is a common skin disorder in people that spend a lot of time gardening, because if you get a lot of cuts or abrasions on your hands and you don't wear gloves, if you get your hands in a lot of dirt and soil, you can actually get the fungus, the fungal spores from the soil can get in under your skin into those wounds. Ulcers could form on the hands. It's usually not very serious, and the treatment is with oral potassium iodide. So a fairly inexpensive medication can actually treat it. But certainly if you're going to do a lot of digging in the dirt and get your hands very dirty, always a good idea to wear gloves. The last one is called candidiasis. Candidiasis is the infection is caused by Candida species, hence the name. It's normal microbiota that usually inhibit its pathogenicity. So what that means is the bacteria that's on the skin in our oral cavity, it usually keeps the fungal species from making us sick. Candidiasis is known as thrush of the mouth, or just thrush. Common issue with babies and people with AIDS. Again, the similarity there is immune systems that are not capable of dealing with this particular infection. And then vaginal and skin infections can also occur, especially in immunocompromised individuals. So again, especially people with HIV and AIDS, candidiasis is a major, major concern for them. And then certainly thrush is a fairly common thing to happen in young babies because their bodies can't fight off the fungus. So I'm going to go ahead and end there because I'm just about out of time for this video. We only have a little tiny bit left to go, but just out of time. So we'll pick up with a third video here and we'll be done in no time.